Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine. Today we're going to look at a great scientific article published in the British Medical Journal. The topic today is about Karela fruits. In Ayurvedic medicine, or if you look in the South Asian countries, a lot of people take Karela to decrease the blood sugar. Scientific, a lot of studies out there. When you take Karela, the blood sugar can go down. Okay, but some people drink Karela juice. They usually crush it in, get the juice. Some people make it like a fried product. Some people make it a powder. So many different forms people can usually take it again. Now, today, we're going to look at, is there any difference between Karela juice drinking versus fried Karela? Okay, what is the difference? Or, is there any difference in the blood sugar level when you use Karela juice versus Karela fried? Okay, now, we need everything we talk in this our presentation based on scientific studies, so we need to have scientific articles to prove it. That is the most important thing about our channel. Everything is based, is purely science. Most of in today's, if you look at YouTube videos, you see chiropractors giving the advice, and they got 15, 20 million followers, and they just talk about what people like to hear. We don't want to give that message. We want to know everything scientific based. So let's look at this study. It's published in the British Medical Journals, very strong journal. Improvement in glucose tolerance due to Momordica charantia, which is actually the chemical name or scientific name for Karela. Okay, so in this study, let's look at the primary author, B.A. Leatherdale, and the senior author, H.C. Bignell, Department of Diabetes and Endocrinology. So well qualified authors, nice journal with a lot of reputation. So, okay, in this study, they're just mainly looking at the Karela juices, Karela fried. Okay, treatment, there is, they have like two arms. They looked at the people and they put it into two groups, and they did the standardized test. What they did, these people were fasting, and they gave this, we call this oral glucose tolerance test. That means you give like 50 grams of oral glucose to the person, and then you measure the blood sugar in 30 to 60 minutes. Okay, so that's what they did in the study. Okay, now, so they also tested in humans and also the rats. What they found out, the blood glucose level at 30 minutes fell from like around 142 to 85. That means almost like 41% reduction in the blood glucose level when they take the Karela juice, okay? And then they looked at this both under statistical tests like area under the curve, and there's a good positive test results regarding the blood sugar. But the significant thing is, when the people who took the Karela juice has significant drop in their blood sugar, but the people who took Karela fried, even though there's a result, it was a small decrease in the blood sugar level. So both are significant, but taking Karela juice, the blood sugar drop was very, very significant. They also looked at the insulin level. That's what, when they have given Karela juice, the insulin level has gone up also, but Karela fried did not improve that much. So Karela, again, a lot of anti-diabetic properties. So if you, in this study, they took like 15 ml of Karela juice, and they have significant result in decreased blood sugar. But even Karela fried, also there's some, if you cannot take the juice, I even recommend taking Karela fried Karela, okay? It's not as, you're not going to have a significant drop as when you drink a Karela juice. So 50 ml of Karela juice can decrease your blood sugar. That's the bottom line. So, we're going to bring like more studies like this. So we can educate people. I mean, and like everything, when you take, there are some complications. We're going to do another video on like the complications of Karela, but it rarely happens. But I think it's good for all of us now. It does, Karela. That's for the next step. Please watch or continue to watch videos. I think your support is needed because you know, everything in this channel is pure science, my friend. Yeah, you know, we talked about it. Most of the people get advice on internet are not doctors. If you look at them, they're not MDs, and they are chiropractors or some nutritionists giving medical advice. But in this, everything is science-based. Please, you know, and like, share, and subscribe. Your support is very important. God bless. Thank you so much.